Hi everyone, so welcome back. Today we're going to talk about point of care renal ultrasound. So you might be asking yourself, when and why do we use a renal ultrasound? What are we looking for? What patient are we thinking about looking at the kidneys on? Well, think about your patient in flank pain. Acute flank pain, you're looking for hydronephrosis, urinary tract obstruction, maybe decreased urine output, or possibly even pyelonephritis. I know, you might be saying, wait, I thought when a patient had sudden onset severe flank pain, I should think aorta as well. Well, you absolutely should think about aorta, especially in your older hypertensive patients, but also think kidneys. So, a little bit about the kidneys. Let's take it back to our gross anatomy. Remember, the kidneys are retroperitoneal organs. They're protected on both sides by ribs and bordered by the liver on the patient's right and the spleen on the patient's left. Now, going into the overall structure of the kidneys, going from outside in, you first have an outer fibrous cortex. Then you have a middle layer made of the medulla or the pyramids and an inner renal sinus of major and minor calyces. And then you have the renal pelvis with blood vessels and the renal hilum with vessels and the ureter. So how do we want to look at the kidneys? What ultrasound probe are we going to use? Now, we want to make sure that we use a low frequency probe just to make sure we have enough depth to get into our retroperitoneal organs. This is either going to be your curvilinear probe as seen here on the left of the screen or the phased array probe seen on the right hand side of the screen. These are both your low frequency probes. However, my preferred choice is going to be the curvilinear probe and then the phased array if you do not have a curvilinear probe. So what's our protocol for scanning the kidneys? First, we want to make sure that we're scanning the kidneys bilaterally. We want to look in both the longitudinal and the transverse planes. I want to scan the bladder. I want to assess for the ureteral jets. When we're scanning the kidneys, we're going to scan from approximately the posterior axillary line. Remember, it's almost like you're doing a fast exam, but instead of focusing in on Morrison's pouch or the parasplenic recess, we're looking specifically at the kidneys. So when we're looking at the right kidney in the long axis, we can see here, we're actually in a more coronal plane with the probe marker in the posterior to mid-axillary line, probe marker facing towards the patient's head. And we're scanning the right kidney like this. On the ultrasound, we can see the patient's liver, we can see their kidney, and then we can measure it in two planes. When we're looking at the kidney, here's what we should see. We're seeing the kidney, we're seeing the liver, we're seeing the diaphragm as well. I think you might all remember this particular clip from our fast exam, but it highlights exactly what we're looking for. We'll just slide the probe down and make sure that we're seeing that inferior pole of the kidney, and we want to fan through. You want to evaluate the entire structure. So now we're seeing the liver, we're seeing the kidney right here, we're seeing Morrison's pouch, we're seeing the diaphragm again, and now we're seeing the spine. So this is going to be our right kidney transverse. So as we do when we're looking for any other transverse view, we are rotating the probe towards the patient's right, as you can see here, and that gives us our transverse view of the kidney. Then we move on to our left kidney. We want to first look for the left kidney in the longitudinal plane. You can see right here, if you're looking at the ultrasound screen, you should see the diaphragm on the far left of the screen, and then you see the spleen, and then you see the left kidney. You might have to rotate your probe just a little bit to get in line with the ribs to make sure that you're seeing the entire kidney here. So if we look here, probe marker in towards the patient's head, probe placed posterior axillary line. So go ahead, put your hand on the bed. You can absolutely ask your patients to roll a little bit onto their right side if you're looking at their left kidney, or onto their left side if you're looking at their right kidney. Don't be afraid. So going back to what we saw earlier, we see our spleen here. We're seeing our left kidney, and that's going to be our area of interest right here. We're seeing that splenorenal recess, now our diaphragm. And now our spine. So very, very similar to what we're looking for in the FAST exam. You're in that exact same location, but instead of your spleen diaphragm interface, now your area of interest is that kidney, and you've got to fan through that kidney completely. And then once again, getting our transverse or our short axis view, we are rotating the probe to the patient's right, and you're going to fan through kind of up to down or cranially to caudally to really evaluate that kidney. And then we are going to go ahead and scan the bladder. We're going to ultrasound our bladder in our two directions, in our long axis and our transverse axis. You can actually take measurements here and calculate out a bladder volume using this equation. Most of your ultrasound machines have this automatically set into their calculation package. So if you are doing a urologic or urinary tract ultrasound and choose that preset, there'll be a bladder volume measurement. So all you do is measure and it calculates your bladder volume. So you could do a pre and post void residual if you like. So what is one of the first things that we're looking for? We start by looking, do the kidneys look normal, or are we seeing hydronephrosis? Hydronephrosis is going to be a dilation of the kidney as it gets backed up by some sort of impingement or obstruction of the ureter. You can have unilateral hydronephrosis, you can have bilateral hydronephrosis, so you'll have to think about your differential for what's causing your hydronephrosis. Hydronephrosis is an overall scale from grade 1 all the way to grade 4, which is severe. Grade 1 is mild, so this is dilation of your renal pelvis. Grade 2 is also mild, and as you go along the spectrum, grade 2, you have dilation of your renal pelvis and now dilation of the minor calyces. When you move to grade 3, you're moving into moderate territory, and now you have not only dilation of your renal pelvis, but dilation of your renal pelvis, your minor and your major calyces. You'll see some blunting of the fornices and flattening of the papilla. This can lead to grade 4 or severe hydronephrosis. So here you'll see severe dilation of your renal pelvis and calyces. You'll have a ballooning appearance, loss of borders, and cortical thinning. This looks nothing like the kidney that you're used to seeing on an ultrasound. So bear with me and we'll walk you through a few cases. So here we're seeing a case of mild hydronephrosis. We're seeing that ballooning of the renal pelvis right here. This is another example of mild hydro. We are seeing dilation of the renal pelvis and starting to see dilation of the minor calyces. And then we're moving from mild to moderate hydronephrosis, you can see here. And so everything's a scale. Nothing always fits completely into, mild, moderate, moderate. You can have mild to moderate grade 2 hydronephrosis. So now we're not really picturing the renal pelvis here, but we are seeing dilation of the minor calyces and starting to see dilation of the major calyces. And now here we're seeing, this is definitely moderate hydronephrosis. We can see here, we're seeing a lot more ballooning and dilation from the renal pelvis upwards to minor and major calyces. And now this is an example of chronic severe hydronephrosis. I know you're probably thinking, what? This looks absolutely nothing like the kidney that I'm used to seeing. And it doesn't. Everything's ballooned out, stretched, and thinned. And so this is your severe hydronephrosis. Some other things that we look for with renal ultrasound are going to be renal cysts. So these are pretty common. They're an anechoic fluid collection with a sharp interface. And when I mean sharp interface, they're clearly designated, delineated. They are round with very distinct borders. This actually, I have a better example coming up in just a second, but they're not sharp as in a square, but clearly delineated borders is what we're looking for. But a cyst is round, so it should be smooth-walled, smooth edges. Here's an example of a renal cyst. So these are completely common When I see one in a patient, I inform them. I might put it in their note and then send their primary care a follow up that this was an incidental finding, but these are incredibly common. Something else that we see when doing renal ultrasound would be nephrolithiasis. So these are your little stones in the kidney. These can actually be a lot more difficult to see because usually they're incredibly small. But if you look closely at this scan right here, there is a kidney stone hiding in there. Look closely. Does everybody see it? So remember, our stones are going to be bright white with a little bit of shadowing, but stones that are 3 millimeters or so may not shadow. So keep looking for something that should be a little more hyperechoic than the other surrounding structures. If you saw this right here, then you're right. Unfortunately, the measurements are on here, so it's not as clear, but this was about a 6 millimeter stone here. And other things to look for would be any type of mass or solid organ mass. So masses are irregular. They don't fit well within that, oh, this is a typical cyst category. They can be hyperechoic or a mixed echogenicity with multiple echoes. They can be irregular without clear, distinct borders. So solid renal masses can sort of look like the bladder mass that you see outlined here, irregular, poor borders, mixed echogenicity. If you're starting to see something like that, I would get worried and refer them for formal radiology ultrasound. So we talked a little bit about point of care ultrasound for renal evaluation. We now know the probes that you want to use, evaluate in the transverse and long axis planes, as well as evaluate the bladder. Look for your ureteral jets, look for hydronephrosis, look for cysts, and keep scanning. Please email me with any questions and take care.